The regulations are killing us. Everybody talks about universal health care. And what do I think of that? Yes, I do not think health care is a right. I don't think owning an automobile is a right. I don't think electricity in my home is right. I don't think having a television is a right. I don't think food is a right. I believe that there isn't anything we do that we don't have, that somebody else has, that doesn't have a fair and legitimate price. Now, there's the question. What constitutes the fair and legitimate price of medicine? And all I can say is that it's become a lot more difficult for me, and my income went down last year, in part because of rising costs, and, but I also did take more time off to be fair and balanced, which Bill O'Reilly is not. I'm not saying I don't agree with many of his opinions, but he is anything but fair and balanced himself. But he's certainly enjoyable and very smart, although I think Dennis Miller, if he would just be straightforward, would be reasonable. But Dennis Miller is so busy trying to be clever and, in that sense, a TV personality that takes away from his intelligence. There is a man who is blindingly quick and intelligent. Anyhow, the angiotensin receptor blockers, the ARBs, the Benecars, and so on, if I had to, I recommend those because they are more effective at preventing diabetes and diabetic kidney disease. They're also more effective. Here's an article on the generic equivalent of, the equivalence of generic drugs. For the most part, I recommend generic drugs as equivalent, but there are some times when I don't. I do not believe that for the men who are taking Cardura that they are getting as good a drug as Flomax. And you can pick and choose your own, do what you will, but I do not believe that Cardura is as good as Flomax. And the urologists I've talked to say much the same thing. But once again, there's that generic argument, and so when patients come in, I'm forced to prescribe Cardura. Remember I was talking about the angiotensin receptor blockers, and I was also talking about the ACE inhibitors. Here's a study that showed that some of the ACE inhibitors, which are able to cross this membrane that we have around our brain called the blood-brain barrier, those that can get through that reduce the future development of Alzheimer's disease. So now what about the ARBs, the angiotensin receptor blockers? Do they do that? The two that I like the most, I do not believe do that. I like Benecar and I like Mycardis the best for differing reasons. Probably the most popular is Diovan, and I don't know whether Diovan crosses the blood-brain barrier or not, but I do know that Monopril, Lisinopril, which is Zestril, Acion, Altase, and Mavic do cross the blood-brain barrier and therefore would have a beneficial effect on brain preservation. It turns out that the statins, the cholesterol medications, they act a little bit like aspirin or Advil or Aleve. They are anti-inflammatory. And so what I'm saying to you is that they too have a beneficial effect on reducing the incidence of Alzheimer's disease, according to this article. Let's see. Heart attack may be reduced by one of the what's called TZDs, and those are the things that got a bad name: rosiglitazone, Actos, and Avandia. Avandia got a bad name. I read the initial metabolic information on Avandia, and I virtually never prescribed that drug and virtually always prescribed Actos, but to each their own. That was my 2 cents on it. Low-dose aspirin protects against cancer of the colon, but I also found out that if you're being treated with what's called anti-androgen therapy for cancer of the prostate, that aspirin, even in low dose, interferes with that treatment. Everything is cost and benefit. There is some good and there is some bad, and you have to look at it overall. Here's a discussion on that drug Mycardis, which is one of those angiotensin receptor blockers, and it has a special portion to it that, not a special portion, it has a special effect that I'm not sure Benicar or Diovan does, and that is it's what's called a PPAR gamma, and that's what Actos is. It's a PPAR gamma inhibitor. Low-dose aspirin, best for preventing cardiovascular disease, and that's because it's effective, and at the same time, it does not cause as much bleeding. For women who seem to be more resistant to the effects of aspirin, or if you've already had angina, heart attack, angioplasty, or stroke, I'm using 81 milligram aspirin, and I used to use it one a day. I'm now recommending one twice a day of the chewable 81 milligram aspirin.